If we don't make the shift in order to get to a point where we can increase top line in a more efficient manner, we will have really detrimental issues as it relates to patient outcomes. My name is Elizabeth Hugh. I am a cornea trained and refractive cataract surgeon. I trained and finished my cornea fellowship at the Baylor College of Medicine Cullen Eye Institute in 2007, 2008. I was very fortunate to have trained under some of the best refractive surgeons, dry eye specialists, complex cataract surgeons, and then stayed on faculty there. Stayed in academic medicine until 2013, where I have been in a multi-specialty private practice. So when I arrived here at the Cape on Friday and I thought of global ophthalmology, I will say that I came very open-minded, not really knowing exactly what to expect of the conference. I know there's definitely so many needs in order for us to move forward. Medicine alone, ophthalmology in particular, whereas in the rest of the world, like for example, digital and how much we've moved forward when you look at the Amazons and everything else. Medicine, we've just really lagged behind, but between regulatory and otherwise, we just haven't been able to incorporate things, and there is certainly a need. And there are also other parts of medicine, not just cataract surgery and retina, but for example, cornea. We're just so behind. There are parts that just haven't moved forward. So I had a very open mind, not knowing exactly who would be the participants and where that discussion would go, but I was really looking forward to it. We are, which I have read recently, actually on the forefront of where artificial intelligence and imaging and digital, even as behind as we are of the different subspecialties, we are pushing and are in the forefront of that. And I didn't recognize that. Even in front of radiology, which gives me hope, which means that people are working on it. But it means there's so much work to be done, and to have a lot of the right pieces of the puzzle, of the pie, to make sure the big strategics, EMR companies, practitioners of different subspecialties in the room thinking about, well, what do we need? What parts is it that are missing, the needs in order to get there? That vision of getting us to a more efficient process because there are double the number of cataract surgeries, for example, for me personally, that I know that are needed to be performed in the next 10 years, and a shrinking number of ophthalmology surgeons entering the field. How are we going to meet that deficit and still keep stable mental health, physical ergonomics? How are we going to do this? So if there's a shrinking supply and an increasing demand, we have to somehow meet this need. So that vision of putting it all together through efficiencies and process, artificial intelligence, better surgical processes, robotics, artificial intelligence, deep machine learning, better instrumentation, that's very exciting. We have to find a way to increase efficiencies, so more effectively improve accuracy through the processes, and increase the way we are effectively utilizing human capital in combination with maybe robotics per se, and maybe how many surgeries we are able to do per surgeon, and utilizing the way each clinician is able to perform at the top of their license and to the best of their abilities. Because if we're not able to do this, for example, for me, my personal satisfaction and my health is going to suffer. If we are able to achieve some of these things, then I feel my personal satisfaction is going to absolutely soar. Because for me, I can see myself then being in the operating room more, being able to take care of the patients that want to see me, in a practice setting in the way I do medicine, personalized medicine in a way that they want to see, medicine in a practice that is technology high, touch points with very specific technicians who are very trained to do what they are best at doing, meeting maybe the surgeon once or twice, but a highly expert level surgeon. That's the type of patient who may want to meet me. That's what I'm envisioning, for example. The workshop process was incredible. I loved it because it was so different. While I've been involved with multiple advisory board settings where there definitely are different breakout sessions where you start, and certainly it was very interactive, but it was just also very different, thought-provoking. So for me, I can definitely say this was thought-provoking at every level, in different ways. Having the process where it was also very visual too. So I will say, creative, thought-provoking, and quite unique. So met my expectations, far exceeded my expectations.